The HEART program really grew out of a recognition of the problem of rising opioid overdose deaths, particularly in certain communities like in Holyoke, Massachusetts. Judge Bill Hadley, who is a judge in the Holyoke District Court, he really wanted to act. He is a judge who sees people who comes before his court, and he recognized many of them did have a problem with opioids. So he saw maybe this was an opportunity to create a new program inside the court that would route people to treatment.
To create a program where individuals suffering from substance abuse disorder would be able to meet with an intern and immediately get access to a clinician and then go on to recommend them to help. So within an hour of arriving at the court and having your hearing, there's a way for these individuals to be able to get immediate help, immediate access to resources that they need in order to recover.
I'm a proud graduate of UMass, and I've always been impressed with the university, dealing with Professor Evans and the students. She gave me some resumes of these students. They were very impressive. They've done research. They've reached out to the police department, to providers. They've gone above and beyond and done things I just don't have the time to do. They've created a publication, a report. They are now in the courthouse staffing our program here. Couldn't have done any of this without Professor Evans and the students. They've been stellar in every way.
Coming into a community like Holyoke has a much higher population of Latinx Hispanic people, which is it's about over 50%. And I say that because the data we're seeing about the opioid epidemic is that in Western Mass, maybe some data is improving, but it's really not improving for people in that population because of barriers to treatment, language barriers, maybe just lack of access in Holyoke specifically.
I think one problem that I've learned about in every single public health class I've taken, and that is, I think, our biggest hurdle to overcome, but it's also our most important one, is this idea of health equity. And I think in any community program that you orchestrate, it's really important to keep in mind what is the population that we're going to be serving. When we interviewed a bunch of key stakeholders as part of our work over this semester, we kept getting loads and loads of different groups of people that we had to pay attention to, like pregnant mothers, individuals with children, single parents, elderly individuals that only speak Spanish. It was really eye-opening to see that it's important to address every group and every individual that you could come across in this program, because you don't want to be falling flat. You don't want to have someone come in and be like, oh, sorry, I don't know how to handle you. No, that's not fair. That's not equitable.
My interest in UMass was because of being able to be a part of big research that goes into effective community programming. And I knew that Dr. Evans was doing a lot of work like that with the opioid epidemic and her previous work.
I was just immediately drawn to it. I read over it and I was like, wow, this is my dream internship. I just loved how that program integrates both of my majors. You have public health planning, you have the overlap between different healthcare centers and the criminal justice system, but then you also have everything to do with mental health and psychology.
But I just want people to feel as though they can enter a program there that's not necessarily part of the court, but is just being offered at that location where they can access services and feel that people are looking out for them and what their needs are, but maybe what they don't even know that they need, and kind of just being able to show people that they can access those resources. And then just totally beyond the personal level, just increasing public health and decreasing overdose deaths and opioid use in the community.
And I'm seeing real world payoff. I'm going to be able to see the impact that we have on the community, and that's even more rewarding than any good grade I could get or anything I learned in school. It's really just transcending my expectations for what my hard work can lead to.